Hey guys, so in this lecture, you're going to cover chapter 1 from your book called Fundamentals of Public Health. And so what this chapter does is it really just introduces the idea of what public health is and some of the things that are related to it. This chapter is really short. Realize this lecture is in combination with kind of reading through the book, so you'll want the book to be able to read through those chapters and kind of pick up some of these things as well. A lot of just basic definition stuff in here so that you can have an understanding of what goes on. And so with each chapter, the presentations, they have objectives that you can look at. I can just kind of scroll through those. Again, you can look at those and make sure you can answer those questions. It always has kind of like an opening question as well. What comes to your mind when you read the word public health? All kinds of things can come to mind with the things that have happened recently. I'm sure you can think of certain diseases that may pop into your mind that public health was talked about a lot. And so you're looking at that, but realizing that we're looking at public health in kind of a different way this semester. The same principles apply, but we're looking at it in a different way. There are lots of key terms in this particular chapter that you should be familiar with. Things like biostatistics and data science. So it's kind of how we make sense of the numbers with all the things in public health. A chronic disease is something that usually develops over a lifespan or over a number of years and is not something that we can give to each other. So an example of this would be cancer. Cancers isn't something like I have lung cancer and I can give you that lung cancer. It's more through lifestyle choices or other things that happen. It's not a virus or a bacteria that causes it. Environmental health being the things around us. An epidemic is a large, something widespread, affects a large number of the population, and epidemiology is a study of that. Health administration and policy, so they're the people who kind of come up with things to govern public health and move people in a healthier way. And the list goes on, and you can find these and know their definitions. And so with this chapter, kind of where it starts is it starts talking about what public health is and all those things around it, and then why is public health something we want to talk about, and it shows us the 10 leading causes of death worldwide for 2016. So a little outdated, but it still holds true today, and it shows you the percentage of the deaths as a whole. So if you had 100% of people, 16.6% in the year of 2016 died from ischemic heart disease, and that equated to a total of about 9.5 million deaths. And when you go through this list, you see things like heart disease, stroke, chronic obstructive pulmonary disease or COPD, lower respiratory system failure, Alzheimer's, and dementia, lung cancers, diabetes, road accidents, diarrheal diseases, and then tuberculosis, which a lot of people, especially here in America, don't even realize still is a big issue. And so what all that does is that points us in a direction that the leading causes of death, the top 10 in the world, are things that are, for the most part, to do with our public health and the way we do things, and these chronic diseases that are things that we have a little bit more control over throughout our lifespan than things like tuberculosis. Tuberculosis is a disease that can actually be spread person to person, and it's number 10 on the list. And even with tuberculosis, we know so much about it that we can take precautions to help prevent those. And so we're going to be looking all semester at really these top things, of course, that are killing people, but looking at a variety of things and how physical activity can affect these. So maybe prevent them, make them less severe, help with the treatment. And so that's what we're looking at. And so that really falls under this idea of public health. Exercise is part of public health and more. And so when you look at public health, they always talk about it's held up by these 5 pillars of epidemiology and environmental health and health promotion, health administration, and then biostatistics. And so that's great. And those 5 pillars are what really make up public health, and physical activity can almost be a base of all of these things. It could be a 6th pillar if you want to say it. It could be up there with public health, but when I look at it from my background, at the very bottom of this is physical activity, because we know physical activity will affect every single one of these things. And so we're going to be looking at that this semester. And so you'll kind of get familiar with these as we go forward. And so when we look at this public health, we usually talk about health promotion as the way that we influence public health, the way that we can do that. And so public or health promotion, empowerment and inclusion. So it empowers people to make decisions. So giving them spaces to, we're going to look at this through exercise, inclusion, making sure that everyone has access to it. We have multiple dimensional, so we're not looking at it in just kids or just from running or whatever. We're trying to bring a lot of things together, even from simply encouraging people to use stairs over an elevator, while also maybe hand washing dishes would be a multi-dimensional approach. And then we always advocate for it as well. And so you can kind of see these things start to connect together, especially as you read the chapter. Again, it's a really informative chapter, laying some groundwork, but not a lot that I'm going to lecture you on, because it would be very boring. It'd be like reading a textbook. And you guys are much smarter and can do that on your own without me having to do that. And so this kind of summarizes everything up, talks about why it's important and the key differences of public health and medicine. That there is a difference in that. They are related, but very different. And the fact it's usually used to create chronic diseases that, aren't spread person to person as easily. And so we'll continue to kind of wrap these things in as we go. The coolest thing that I'll mention in this particular video is the review. It talks about things. You've got your book, and your book should come with an access code online, and that access code online to that ebook or whatever has some really great resources from key terms, which are much easier to read that way. It's got study questions that if you can answer those, you're going to be prepared for the exam and for this course. Gives you some wrap-ups and resources and practice questions, and just gives you more depth information. And I find it to be pretty useful, almost more useful than actually reading the chapter. Definitely go through that chapter, but you can get a lot of that information from those review resources. And so check those out and then use those for each of our chapters. Hopefully this was helpful. We're just getting started, so this is an easy chapter warming up, and then we'll continue to move through the rest of them through the semester.